like to start with a land acknowledgement. We acknowledge that the University of Alberta is located on Treaty 6 territory and respects the histories, languages, and cultures of First Nations, Métis, Inuit, and all First Peoples of Canada, whose presence continues to enrich our vibrant community. Next, I would like to thank Paladin, Astellas, and AstraZeneca for their support of the ATI seminar series. And for the people that are here in the room, we'll be passing around an attendance sign-up sheet, or I think right now it's located on the outside on a table. As part of our reporting to our creditors and funders, please add your name and email to the sheet and pass it along when it comes to you. And so it's my great pleasure to introduce today's speaker. Dr. Patricia Gongal is the Executive Director of the CDTRP. She completed her PhD in molecular biology and genetics from the University of Alberta in 2009 and a postdoctoral fellowship in developmental biology at the École Normale Supérieure in France. She has worked in a variety of roles supporting researchers and research programs, including as an independent scientific writing consultant, as a research development officer at Aberystwyth University, UK, and as director of major grants at the University of Alberta's Faculty of Medicine and Dentistry, where she developed, implemented, and managed the strategy for large-scale research funding initiatives. And she has been with CDTRP since 2020. So today, Patricia is going to talk about the Canadian Donation and Transplantation Research Program, evolution into a national research development and support network. Welcome, Dr. Gongal.
Okay, so thanks very much. I'm really pleased to be giving this presentation today. Over the last number of months, Lori and I have been wringing our hands about really better communicating what the CDTRP does to the ATI and University of Alberta researchers. And so that's what we hope to achieve today. So the formal title of my talk is Evolution into a National Research Development and Support Network. We could equally title this talk, What CDTRP can do for you as researchers and members of the ATI community. So begin with disclosures. I have research funding with AstraZeneca and CDTRP related to projects that you'll hear about, but no other relevant conflicts. And also I'll note in terms of acknowledgements, all the way along, I've noted partners and people that have contributed to the work that I'll present. So consider that acknowledging all of the wonderful contributions of everyone to this large-scale program. So where it all began, Lori could probably better tell the story, but I'll try and do so in a nutshell. It all started with a call from CAHR. for a project-focused network grant in transplantation. And the mandate from CDTRP was to have a network of projects that covered some of the disciplines related to donation, transplantation, solid organ, hematopoietic stem cell transplant, and donation and critical care. And so cutting to the end of that part of the story, the CNTRP, Canadian National Transplant Research Program, as it was called at that time, was the winning proposal, led by Laurie West and co-led by Marie-Josée Hébert. And with this team of over 100 investigators on this proposal, ranging geographically across the country. So that was in 2013. So already this was a large initiative, and it was meant to be transformative. The CNTRP was structured in 7 projects and 4 cores. So you can see the themes of those here. In particular, I'll mention the cores: ethics, economics, legal, and social issues. Core 2, research infrastructure. Core 3, training and career development. And Core 4, patient researcher partnerships. So the whole idea behind this, the 100 arrows on this figure, are that every project and every core had a connection and were integrated. And this integration was felt to be really imperative to the innovative nature of science and research. And that's where you get the creative collisions of different groups across the social sciences, the natural sciences, and the health sciences, as well as the structural support in terms of training and infrastructure and so on that are required. Alberta research excellence was a really critical part of the CDTRP. I pulled out just a handful of the names from the original proposal for this figure. A lot of folks who have very amazing and impressive research programs here at the U of A in all kinds of disciplines were part of that original proposal, and that work that the CNTRP supported has really laid the groundwork for many different initiatives that we're seeing the fruits of today. Some of those notable examples: ex vivo perfusion technologies. That was one of, I think, project 1 in the previous figure. Those technologies are a reality now. These are some news clips from a couple of years ago, and the folks in these photos could no doubt give wonderful talks about the evolution of those technologies and how they have progressed to increase the access to transplantation for patients based on the limited donor pool that's available. Another example is the positive study. I was digging through old CNTRP presentations here and found this one with a photo of Simon Urschel, who hasn't aged a bit, who is involved in this study focused on pediatric transplantation specifically as a field. And he should also give a seminar about all of the work that's come from that study. Thinking about the social sciences and the Alberta impact of that area on donation and transplantation scholarship. This is Tim Caulfield and Megan Taves, who is an alumna of the U of A. So she graduated in 2020 with a PhD in law, and some of the work that these two did within the framework of the CNTRP was on the perception of so-called family veto in organ donation in the public press. And we know that the narratives in the press have a real impact on the culture of donation and the perceptions of donation. And so that was some really important work at that time that continues to evolve. Megan, you'll see in a later slide, she's now a legal scholar in Australia and has contributed in that capacity to some additional projects that I'll share a bit later. So in 2018, this was the scene. the network had gathered, this was the landscape of partners who supported through collaboration or through funding the projects that had evolved. The group had turned the $14 million of the original funding from CIHR and other partners into over 40 million. So already, thinking about leveraging how to take the resources that we have and turn those into something even better and even bigger is sort of built into how we think. And in terms of outputs, at that time, there was over 100 publications, academic publications coming out of this work, almost 600 international, national, and local presentations, 10 new clinical trials initiated, 16 new methodologies, 3 clinical guidelines that were informed, and much more. So then what? Then in 2018, that original grant, the end date was approaching, and given the success of the program, CIHR took the very unusual step of structuring a renewal as a directed grant. There was no mechanism for renewing the original network grant, but CIHR, in recognition of the success, created one. Another key change that happened at that time was we changed the name to add donation to the title to recognize the enhanced capacity for donation research across Canada that the CDTRP helped instigate. So we're now the Canadian Donation and Transplantation Research Program. A key difference from the original grant to the renewal in 2018 was that the CIHR funding was not to be used directly for research, but to support research infrastructure. And that was a really key change because we already felt pretty strongly about leveraging and how productive that could be. But this really renewed that focus, because that was really the only option then. If we didn't have CIHR funding to put directly into projects, we needed to do the legwork to do that as a group. And so with the renewal, the network always was open to new collaborations and new people. But with the change in structure and mandate from CIHR, it really opened up the opportunities for really anybody to get involved, because it wasn't tied directly to a specific grant. And so this continues, this openness is something that we're really trying to communicate today. Anyone interested in advancing research in Canadian donation and transplantation is absolutely welcome to join us and take advantage of all of the opportunities for support that we can provide. And particularly members of the ATI, every one of you should be a member of the CDTRP as well, in my opinion. So what we really are trying to do in the CDTRP, and how we see ourselves now as a national network, is as a connector of the national research ecosystem. With the large network of investigators and trainees and patient, family, and donor partners that we have now, we can draw on that to tackle national issues from a research perspective, with the support of over 100 partner organizations now as well, across sectors in Canada and around the world. So we're, in particular, over 200 researchers in Canada, 95 trainees, 77 as of today, patient, family, and donor partners who are active in research teams and a number of other capacities, as I'll talk about, working on 111 active projects as of today. We are still working to bring together the solid organ donation, critical care, and the hematopoietic stem cell communities together, focused on patient families and donor priorities, and that's continuing work as those disciplines continue to develop. So our mission and purpose, we recently refreshed, and here it is, driving advances in Canadian donation and transplantation research and mobilizing that knowledge into action so that every wish to donate is fulfilled and transplantation is transformed from a treatment to a lasting and sustainable cure. And we think that the research and knowledge mobilization are the pathways to achieve that. So our focus is enhancing collaboration amongst the different research communities across tri-council research areas, taking a transdisciplinary approach from all perspectives, all sectors, leading areas of research collaboratively that are identified as patient, family, and donor priorities, maximizing the effectiveness of research teams. This is where our infrastructure comes in through funding development, project support, patient, family, and donor engagement support, and knowledge mobilization support, with the goal of mobilizing that new knowledge equitably so that patients, families, and donors, as well as health systems and partners, equitably benefit from the results. So what we do really on a daily basis and how we pursue this mission is the remainder of my talk. So first, focusing on funding, as we know that's a critical area to generate resources for the research to take place. We have our annual research innovation grant competition. And we're also, continuing to focus on leveraging, supporting investigators as they seek external funding. Our 3 research support platforms that I'll go into: research services, education and career development, and patient, family, and donor partnerships. And then the work that we're leading as a network in terms of national initiatives. So the Innovation Grant Program, it's an annual pilot project grant program, $30,000 for projects in any area of donation and transplantation. This program has awarded $3 million since its inception, so it's very significant that the investment that this has generated over time for the community. It runs annually, as I mentioned, so that the next one will launch January 2024, and our deadline is in spring every year. It'll be in March 2024. Here are some of the partners that contributed. So the structure of this program is based on partnerships. So all of these organizations that you can see on the slide contributed grant funding in 2023. In addition, CDTRP itself contributed one award to ensure that all geographic areas of Canada are covered and all areas of donation transplantation are covered, because each organization has certain limitations, of course, on the mandate for its funding. The Kidney Foundation, of course, supports work in kidney transplantation and related projects in donation as well. Alberta, the ATI funds researchers based in Alberta and so on. But with the structure right now, everyone in Canada is eligible, on any research discipline is eligible for at least one of these grants. Shout out to the Alberta-based winners from this year, Jason Weatherald, Simon Urschel, and Michael Coury, the first 2 funded by ATI grants, and Dr. Coury through Big Gifts for Little Lives. Over the last 10 years, Alberta researchers have received just over $600,000 in funding from this program. Next, thinking about leveraging and support for external funding opportunities. So we write many letters of support for grant applications every year. Last year, we provided 55 letters, and we're pretty proud of our track record of success with those. So of those 55 last year, 21 of those were associated with successful grants. And certainly we hear from, obviously full credit to the PIs for developing amazing projects, but they tell us that they think that our letters of support make their applications more competitive, and we're very happy to do that. So we, in our letters, are real commitments of cash and in-kind support for projects, and these totaled almost $600,000 in the letters that we wrote in 2022. Those 21 successful grants included some large partnership based network grants, but the total of those was over 46 million, which is really exciting as investment linked to these areas. So I'll dig in now to what those commitments are to projects that are available to PIs. And this is through our research services platform. So continuing right from remember the economics, ethics, and legal and social analysis that were a part very beginning of the CDTRP. This is how this has evolved. We are able to provide $10,000 in cash leveraging support that folks can include in their grant applications that we will provide should those be successful, and as well connections to experts in those areas who would be able to help carry out those additional studies that are really helpful to ensuring that the research is set up to be able to follow knowledge mobilization pathways and have impact. And we know economics, ethics, law, and social sciences are really critical to making sure that happens. We also offer methodology support specifically for clinical trials, but some other areas as well through a partnership with the Ottawa Method Center. We offer 10 hours of consulting with experts funded by CDTRP. The idea of that is, of course, to improve the quality of the project that is proposed and also increase the likelihood of success in funding. This was a partnership set up by my colleague who's here, hooray, Katie Bain, who arrived just in time for a team retreat to join us for this seminar. So that was a partnership that she created. Otherwise, in terms of research development and management, hands-on things that are useful to projects, over the years, so we're developing this into a more systematic offering, and I'll talk in more details about that near the end of my talk. But these are the kind of supports that have been available all the way along to the community in different ways. Grant writing support, advice on budgets, team development, and connections to interdisciplinary researchers that may be valuable for a particular project. Support with execution, coordinating data between different sites of your multi-site study, coordinating project meetings, doing some of the heavy lifting in terms of developing a governance structure for your project and authorship policies that 10 years of hard-won experience has shown us some good practices in those regards that can really make a difference to how smoothly a project runs. A data safety monitoring board for trials, we run that independently. A colleague, Julie Turgeon, coordinates that. And really all of these supports that can make a project run a little bit more smoothly and be more successful. In terms of communications and knowledge mobilization, so these are some of the supports we can offer, help people develop KT plans to go in their grant applications, and then help the teams carry those out, whether that's producing materials, brochures, posters, promoting recruitment for studies through our network and through our large partnership network, which includes quite a number of patient-facing foundations and associations and organizations. Support for events. This is our colleague, Stéphanie Larivière, who's really the tech genius when it comes to hybrid and virtual events. And she will keep your team on track to run those smoothly. And any KT materials at the end of a project that may be useful, lay summaries, fast facts type documents, events again, we can support all of those things. So shifting gears, the education and career development platform has continued from all the way from inception in 2013, and we offer a variety of supports to trainees to build their network and enhance their professional development. We run our Research Connect webinar series every other Tuesday during the academic year with a variety of speakers across all of the disciplines of donation and transplantation. We offer funded training opportunities, specifically in Indigenous cultural safety and data sovereignty. We've got 10 seats on the OCAP training course on data sovereignty that are available now if trainees are interested in taking advantage of that. Knowledge mobilization as well. And really critically, I think the most useful thing that we really offer to trainees is the integration into the network and participation in some of these large projects where trainees are really able to build durable relationships by like hands-on project work with folks across the country that really are hugely helpful for developing their career. So I'll next to talk more about our patient, family, and donor research platform. And so the platform was launched in 2016. Patricia Gongal was the lead of this, and with the help of Sylvain Bédard, who is a two-time heart transplant recipient. And this is the oldest figure to convey the structure of this. And what I really like about this is that it pulls out individuals exactly where you have a patient, family, or donor research partner in the projects. And there is no way we could make this figure now because we have 77 individuals doing all kinds of things. So the growth of this platform and the diversity of roles for patients and families and donors in research has really expanded. External scholars tell us that we are leading the country in the development of patient and family partnerships and strategies for engagement. And we're really proud of this. This is something that's really core to the identity of our network, and we think keeps us honest and on the right track when it comes to the focus and the projects that we undertake. As I mentioned, we have 77 individuals across the network. We have 46 active projects engaging patient, family, and donor PFD partners as part of their teams. Some of those expanded roles include peer reviewers. So we have integrated PFD reviewers in our innovation grant program. We have PFDs moderating and speaking at our seminars regularly. And with these individuals also have an expanded role in CDTRP governance. So every theme has a PFD co-lead, and this platform is expertly managed by Manuel Escoto, who we're very happy to have on our staff team. What is really important about our platform is that we take both a practical perspective and a scholarly perspective in terms of developing best practices and structures to support effective patient engagement. So just a screen cap of a few of the academic publications that Marie-Chantal Fortin, Sylvain Bédard, and others developed when the platform first launched. And then the last one is an academic publication specifically with recommendations for patient and family engagement in the context of donation research. And so the previous executive director of the CDTRP, Mélanie Dudier, is the senior author of that, and Manuel is the first author. So we're proud of the academic development of this field, as well as the practical things that can be helpful in ensuring that projects can successfully engage patient partners and take advantage of all of the benefits that doing so brings. Another example of that focus on supporting the community in the academic development of this, here's Manuel presenting a panel at the International Transplantation Society meeting in Niagara-on-the-Lake earlier this year, focusing on basic science and what does that mean, patient engagement in basic science? How do you do that as a researcher who never sees a patient otherwise? And what does that look like? In terms of capacity building and opportunities to build skills, we run our Patient, Family, and Donor Research Forum now annually. This is a standalone event. Planning committee is majority patient, families, and donors, with the goals of building resources in the community, sharing best practices and different approaches for carrying out patient engagement equitably and effectively in all areas of the research lifecycle, from developing projects, executing them, and mobilizing that knowledge as well. We're grateful for the support of all of these organizations. This was for the most recent edition in June, for helping us promote the forum, providing financial support, and assisting with the planning committee in some cases as well. So from a practical perspective, this is what the supports really look like day to day. So we can support and co-develop a patient engagement plan with the researcher for their grant application, share the opportunity with our PFD members if they are interested in getting involved or joining a project team. And doing all of the things that a research team needs to do to make sure that engagement happens effectively, including wrapping up and closing the loop when a project completes with PFD partners and taking it forward into knowledge mobilization. Speaking of knowledge mobilization tools specifically for patients and families, we launched a couple of years ago now, and continue to add new modules and new sections, the CDTRP patient portal, which we envision as a one-stop shop for patient and family resources on all aspects of their journey. There's over 200 resources currently uploaded on the platform. Patients and families can search by geography or topic or organ, and find reliable and trustworthy information that is vetted by CDTRP and the steering committee. Grateful for the support of industry sponsors to make this resource available. And we're also partnering now with the Transplant Ambassador Program to communicate the existence of the portal to the patient community in dialysis centers, beginning in Ontario, and they have national aspirations as well, to make sure patients and families know that resource is available. So we're trying to connect the dots, creating the knowledge mobilization materials, getting them to patients, and doing that where patients are, finding them in the clinics and in the communities, to support that knowledge mobilization pathway. A new addition has been some additional resources for patient engagement itself. And so there's a form. If you've got, on your research project, you have an opportunity or you're looking for a patient partner to join your an advisory committee or your team, you can provide all of the information that PFDs might want to know to make a decision about whether they'd like to join. And that's publicly available on our website for people to have a look at it and see what opportunities they might like to take advantage of. So the next section, I move into a few examples of where all of these things are coming together to achieve big things in a nutshell. We started, this started before I joined, of course, but we as a network are seeing the fruits now 10 years later of some of the work that was done, and are also initiating some new exciting projects. And so I want to provide a couple of examples about how all these things are coming together. So one of the early projects that the CDTRP at that time supported was the DPART study. And this is really a good example of where the framework of our network was able to push the boundaries of research using a collaborative approach. So the research team in question here, and as you will surely agree, for donation systems to work, everyone has to trust that system. And the process of determining death must be trustworthy. And it's really, really important that everyone, of course, first and foremost, families can trust when their loved one is declared dead in the ICU, that they have confidence in that. And there were stories and perhaps still are, of people coming back to life after being declared dead. And the research team here, led by Sunny Dinani, acknowledged that the scientific understanding of the process of dying was not as strong as it should be. And so he, with 0% allocated time for research, I will add, together with a collaborative team, launched the largest international deceased donation trial in the world, with sites across the country and internationally. University of Calgary, I think, actually had the largest recruitment numbers of any of the participating sites in the study. And there were a few, this was a difficult study to get going, as this quote from Sunny exemplifies. It is very hard to go into the ICU. What the study entails was measuring a suite of physiological variables as someone goes through the dying process in the ICU. So how do you approach first a family to get research consent in that kind of very difficult scenario, the worst moment of these families' lives, and how do you do that in an ethical way, in a robust way, with the support of local physicians teams and allied health staff as well. And the team's answer to this was by involving all of those people directly. So they identified a donor family partner for their study, whose name was Heather Talbot, amazing lady who lost her son in a very tragic car accident. And as Heather will say, Jonathan died a hero and became an organ donor and saved a number of other people's lives. She joined the team as an advisor, and her input on the donor family perspective was really important to give the team itself confidence, to give research ethics boards confidence, and the impact of having her input on consent forms. For example, they achieved a family consent rate of 93% in the study, which is amazing. So the team also involved frontline clinicians and donation coordinators. Of course, they're super crucial, but it's also thinking a step ahead to how the results of that study are going to be implemented in clinical practice. These are the same individuals who are declaring death in the ICUs as part of their practice every day. And the study was really important, and that was recognized by a publication in the New England Journal of Medicine in 2021 when this study was completed, and Heather Talbot was a co-author on that paper. Since then, this paper is one of the pieces of evidence that was considered in the new guidelines for death determination that were developed by CDS and collaborators. So that has been one pathway to clinical impact. CDTRP also supported the pathway to public impact and thinking about the impact on public trust. So what the study really found was that the so-called 5-minute rule for death declaration, the point where you can proceed to declare death, was valid, that there was scientific evidence for that. And so we supported CDTRP in collaboration with the lead institution communications office, wrote a press release, and we ran a press conference for the study lead, Sunny Dinani, to talk about this. And we had really a pickup of the press release all over the place, which we're really happy about. 22 mainstream media articles in all of these places that you can see on the screen, as well as internationally. The footage of Sunny there in the middle is our Zoom recording, which we made available to journalists, which we're really pleased to see got picked up, and so this was wonderful to see. top quality science in the New England Journal also making it into the public domain for discussion. So then the next big example project that I'll talk about is the International Forum, or the complete name, the International Donation and Transplantation Legislative and Policy Forum. So this was a project directed by Matthew Weiss as a scientific director, who's a pediatric intensivist and very interested in improving donation and transplantation laws and policy. The initiative was hosted by Transplant Quebec, and CDTRP was the co-host. And over a consensus building process, which included a hybrid event in 2021, bringing together around 50 expert participants and 14 patient, family, and donor representatives from Canada and internationally, they developed evidence-informed consensus recommendations for the optimal donation and transplantation system. And the output of this, which are now published, was 8 scholarly publications in a special edition of Transplantation Director earlier this year. Transplant Quebec invested their support in CDTRP to take forward the knowledge mobilization work of this project, now outside of Quebec and in the rest of Canada and abroad. Which we were very pleased to do, and through a partnership with the ATI and the Alberta Organization Group, a community-based collaborative here in Alberta that advocates for an improved donation system. We worked together, and we're really happy to connect the evidence-based consensus recommendations from the International Forum to a political process that was going on at the time in Alberta. So at the time that the academic publications were being written, Bill 205 was being proposed by MLA R.J. Sigurdsson, as you can see here in the photo. And so connecting the timeline, the academic work, with the community groups that were advocating for the bill, and to have that bill be really the best quality that it could be for an improvement to the Alberta system. We developed a relatively simple document, fast facts in lay language about mandatory referral, which was one of the key changes in Bill 205. That was passed. So Manuel on the team wrote this, and we produced it in a way that was easy to read and attractive, and with the help of graphic design on Stephanie on the team. And we, through those partnerships, made this available to MLAs, both on the government side and the opposition side. And during the debate in Bill 205 in the legislature, some of the text, almost verbatim from that lay summary, was used in speeches in the legislature. So Bill 205 was passed last year. It came into force April 1st of this year. And we were really excited from a KT sort of perspective. It's hard to imagine a bigger KT success than that, putting research into action so directly. So that was really, really exciting. The next project, of course, COVID-19 has been really a dominant issue for the transplant community for the last number of years, and CDTRP has been working to build, and to support research on the national scale on this topic as well. So the project that I'll talk about today is now called Treat COVID, Emerging COVID-19 Issues in Transplantation. So in March 2022, we held a National Consensus Building Forum to get community input on what the key issues were in the pandemic in that moment. And this was chaired by Marie-Josée Hébert and Dima Kabani, researcher and clinician here at the University of Alberta. The forum included all kinds of different perspectives, biomedical and clinical researchers, industry, government, patients, to identify what the most urgent issues were that, that we could address as a national community. At the conclusion of that forum, we understanding the very significant impact of mental health on mental health and quality of life of transplant patients, we wanted to dive a little bit deeper and get some additional views or more community views from patients and families. And so for the project, we identified patient and family co-leads. Sherry Logan, who's a transplant mom, and Rink DeVries, who is a heart transplant recipient, to represent both the pediatric and adult perspective. And they ran a follow-up session at the 2022 Patient, Family, and Donor Research Forum to get more specifically patient and caregiver views on key issues related to COVID. And with the outcomes of those discussions, where we landed in the project was a prospective observational study with 3 different lenses, looking at first clinical outcomes, second specific mental health impacts, not only understanding them, but developing and piloting some strategies to improve well-being. And then from an economic perspective, the impact of COVID on the healthcare system, but also at the level of the household for patients and families. So the team that we have spans 5 provinces and 12 transplant programs who are collaborating on this study. And we've been successful in securing funding for this now with some creative strategies. So the backbone, of course, is, well, of course, you may be aware, if you've heard me talk about the study before, which I care a lot about, is Health Canada with a $1.8 million contribution that's held here at the U of A by Laurie West. When we had the backbone in place, or we were developing this, we knew that we needed to scale up that budget to be able to achieve all of the things that we wanted. And so we started knocking on doors for partnerships and applying to additional sources. And here's what we have confirmed: 6 different funders, in addition to the Health Canada grant, over $200,000 from the University Hospital Foundation here at the U of A, held by Dr. Kibani, which we're grateful for. I hold a small CDTRP grant here at the U of A for that, and then additional funders for folks across the country as well to support the different regional sites. So DEMA has recruited the first 3 patients for the study here at the U of A this week. And so we're really excited about rolling this out and to have an agile approach to continuing national consensus discussions about the most important questions with the data set that we'll be collecting, covering those 3 lenses. Okay. So these are just a snapshot of some of our successes and projects in progress. And I wanted to spend a few minutes about where we're going, and of course acknowledge the leadership of the CDTRP and folks that have really invested their time in the success of all this. So as the CDTRP renewal was the end date of that sort of began to loom, we're thinking about how do we make the CDTRP sustainable, and also from a strategic perspective, what are the things that we should be doing that are the most important. And so the national ODT or organ donation and transplantation community saw a need for better alignment. This was voiced by the collaborative that's was developed by Health Canada with partners across the country. And so the decision-making and accountability working group of the collaborative oversaw a project that we executed to understand first having a complete view of the national research ecosystem, and then bring that community together to develop a shared vision. So that work was completed in 2022, and it'll be discussed at a national level by the collaborative, and CDTRP is really thinking about those recommendations and that shared vision as well in our strategy, and how we can continue to support the national research ecosystem in the most effective way. And on the financial side, we have a sustainability strategy that, from a financial planning perspective, I'm satisfied with, and I think we can carry forward. This is an area of active work for us right now. We've renewed our dedication to partnerships with industry and foundations, which are core to supporting different activities. We're submitting a lot of grant applications these days for different projects and different events that matter that we're running. And we're also developing all of the supports that I've talked about. To date, we've been able to offer in kind with the support of the CHR and other funders. But we're working on a new model for that, which involves cost sharing, and I'll talk a little bit about that. So between these three strategies, we believe that we'll be able to continue driving advances in donation and transplantation research and continuing to pursue that mission long into the future. So I'll go, and time's ticking, so I'll zip through some of this, but essentially for our research services, what we're moving towards is rather than everything offered in kind that we're able to offer, some of those things we're asking PIs to cost into their grant applications. So we trialed this model with our executive committee earlier this year, learned a whole lot, and I'm now learning a lot about business processes, and we are working out the kinks to develop this as a process that we could launch nationally and be able to handle the volume of requests that we get for our supports in a way that's sustainable for our team and financially sustainable as well. And our goal is to be ready to launch that in time for the next project grant deadline in the spring. Results of our trial period are looking pretty good. So we, particularly for small planning grants and event grants, we've put in about 9 of these and have been very successful with those. We're thrilled to have 6 out of 6 Café Scientifique grants, for example, that we put in for the March competition with 100% success rate for those, which is amazing. And some larger grants, the results still to come. But this is the direction of travel. And those the last line on this table, 8 planning and dissemination grants submitted to CIHR for the July deadline for that many different projects, mostly through force of will of Katie Bain, who did most of the heavy lifting while I was drinking wine with my feet up on vacation during July. So last, the acknowledgements and the leadership and who's behind all of this work. Of course, Laurie West as the scientific director, and Sunny Denani is our co-director. This slide still looks a little bit lonely without Jean-Sébastien Delille, who was our stem cell lead and is now leading T-cell in his own right and has stepped down. And Marie-Josée Hébert, who had to step down as co-director because she was appointed chair of CHR Governing Council. And as part of the selection process for that, she recounted that her leadership in developing the CDTRP was cited by the selection committee as part of what made her really a strong leader for not just transplantation research or donation research, but for Canada. And research in all areas of health. So we're very, very proud of that. Our theme leadership, which is just a wonderful group of people. I will just note here that the only Alberta representation currently on an executive committee is the Muka from the University of Calgary and Jen Wolfsmith, who's a donor mom also from Calgary. We do not have any University of Alberta representation here, which is surprising given the strength of the research here. So that is all I will say about that. And of course, our membership, who are absolutely wonderful, 200 members across the country. I feel very strongly that they are excellent because we are very diverse, and that's where you get diverse ideas. So this is some preliminary data. We meet Canadian demographics, or indeed are more diverse than the Canadian general population in terms of our membership, which is great. So we know, of course, we know that the diversity is there. There's still a lot of work to do in making sure everyone's voices are included and people feel like they belong. But we feel like we're on the right track. And then lastly, just an amazing management team that I have the privilege to lead. There's 8 of us, and what a bright and hardworking group of people who absolutely bring their A game every day, and who just are a joy to work with, and a scrappy team that gets things done for you. We are doers and not advisors. That is how we see ourselves. And that is it. So thank you very much.
Thank you, Patricia, for this wonderful talk about the CDTRP. I was wondering if there's any questions. The audience is quite small, so maybe some people that are joining virtual. Are there any questions? Do we have anything in the Q&A? Have you been keeping track? Sean is keeping track of everything.
Hi, Esme. No, nothing yet. Just a fantastic presentation remark from Linda Powell, one of our AOG leads.
Perfect. Great. Well, just raise your hand if you have a question, and Sean will keep track of it. I see a hand waving here. I just want to make sure that I'm covering all bases. Lori, you have a question.
Do we need the mic here for people online to hear?
Yeah, go to the mic. Forget how this one works.
Thank you, Patricia. That was just a fabulous overview. And as you took us back to 2013 and before, there were lots of memories that came out from the early days. But you will be far too modest in acknowledging your own leadership here. And I just want to say that, we've had shifts and talented people come in and out, as happens when you have a talented group of people. But Patricia's leadership as the executive director of the CDTRP has seen a real advancement in how the team is organized and structured, and these many new ways that the funding realities, that the COVID realities, that all the challenges that have been faced in the last 5 years especially have been managed. So bravo, Patricia, and thank you for all you do for the team. Dan might have had a question.
That is great. Thank you. There's just a lot of accolades here about all your fantastic work. I think I see one question.
Yep.
Do you want to do it, Sean? You want me to do it?
No, you're reading it. Go ahead.
All
Thanks,
right.
Esme.
So Michelle Skogstad asked if there's a place for living donation representation.
Of course.
Yes.
Of course. Yes. We have a number of members focused on living donation. Somebody should put the link to join CDTRP in the chat. Yes.
And I feel with that somebody is you, Sean.
I have a question. I don't know if there's time, but it's just a quick one.
Yep.
Should I go to the microphone or can people hear me online? I don't know. Okay.
Yeah.
Thanks, Patricia. That was fantastic. I'm just curious. I know there's a lot of international representation in CDTRP. Can international people be members, as well? Is that just there's no restriction just because it says Canada in the name? It doesn't matter. You can still join as an international person.
Absolutely.
Correct?
Yeah. We have members from Brazil, from the UK, and from Iran. We haven't figured out exactly what there's certain. Oh, in Spain. Thank you. And so membership is open really internationally. We haven't worked out all of the kinks exactly what supports we can provide internationally, especially with the new cost-sharing model. Because then you're talking about international finance and contracts, but certainly in terms of the network, international folks are quite welcome.
Okay, thank you.